My name is Connor Byers, and this is my head to toe, not so close, please. My head to toe assessment. And this is my sister Emma, as she's gonna be my patient. Knock, knock.
Come in.
Hi, my name is Connor. I'm gonna be your student nurse today. I'm gonna perform hand hygiene. I'm gonna give us privacy. I'm going to raise the bed to working height. Can I look at your armband? Can I verify your name and date of birth?
Emma Byers, 08/21/06.
Okay, so at first inspection, patient dress is appropriate for the exam. Their speech is normal. They are on room air, and their breathing is not labored. So I'm going to do a head to toe assessment on you. I'll start from your head and go down to your feet. Do you mind if I touch you during the exam?
I don't mind.
Okay, so we're going to start with your head. Upon first inspection, the skin is appropriate for ethnicity. I'm going to feel for any lumps or masses on the head. There were no lumps or masses noted. Now I'm going to check your ears and nose. The ears and nose are normal, and there's no redness or any drainage noted. Now I'm going to assess your pupils using Perla. I am going to rate your pupils at about a 5 right now. I'm going to shine this light in your eye. Pupils went from about a 5 to a 4. Now I'm going to have you look at the wall, and then when I say look at the pen, look at the pen. Look at the pen. Okay, pupils are equal, round, and reactive to light and accommodation. Now I'm going to go on your neck. I'm going to check for the JVD vein. JVD vein is flat. Now I'm going to listen to your carotid pulses. Carotid pulses bilaterally are +2, which is in normal range. Okay, now we are going to do your arms. If you'll pull up your sleeves, please. Skin is normal for ethnicity. I'm going to feel. Sorry if my hands are cold. Skin is dry and warm to the touch, which is normal. Now I'm going to check your brachial and radial pulses. Okay, brachial and radial pulses are +2. Now I'm going to assess your capillary refill in both fingers. Because she has nails, I'm going to press on the sides. Capillary refill is less than 2 seconds, which is perfect. Now I'm going to check your grip strength and your muscle strength. I'm going to have you grip my fingers. And I'm going to ask you to push on my hands. Push up. Grip strength and muscle strength are good and normal. I'm going to check the bony providences on your hands and look for any dryness or cracking. Bony providences look good. I'm gonna look at your elbows. Okay, another elbow. Awesome. And there was no skin breakdown. Good. Now we're gonna go to your legs. Can I ask you to pull your leggings up a little bit for me? Okay, so now I'm going to assess the skin. The skin looks normal for ethnicity. I'm going to feel. Skin is dry, warm to the touch, appropriate color, pink tones. Now I'm going to assess for any edema, swelling, or redness. There's no edema noted. Now I'm going to ask you to take your socks off. I'm going to check the capillary refill in your toes. I will hide your toes. Yeah. Okay. Capillary refills less than 2 seconds bilaterally on both feet. Now I'm going to check your dorsal pedius and your posterior tibialis pulses. Okay, both pulses were +2. Now I'm going to check your muscle strength in your legs. Ask you to push up on my hands. Okay, push down. Dorsal muscle strength in legs bilaterally are good and strong. You can pull your leggings down.
My socks.
I'm going to assess the bony prominences on her ankles. They look good. There's no skin breakdown. Now I'm going to listen to your heart sounds. You can put your socks on if you would like, yes.
Go ahead.
Okay.
Just let me put these away.
I'm going to assess the aortic, the pulmonic, the Erb's point, the tricuspid, and mitral valve. The aortic is in the second intercostal space on the right sternal border. The pulmonic is in the left intercostal, or in the second intercostal space on the left sternal border. Erb's point is on the third intercostal space on the left sternal border. The tricuspid is in the fourth intercostal space on the left sternal border. On the left sternal border, and then mitral is in the midclavicular line on the left sternal border. Aortic, tricuspid, or pulmonic. Now I'm listening to Erb's point. Tricuspid, and the mitral. Okay, I heard S1 sounds best at the apex of the aortic, and S2 sounds best at the base and in the mitral location. Now I'm going to check your apical pulse. For 1 minute. Okay, apical pulse is +2. And there were no murmurs or there were no murmurs in any of the points, and normal rate and rhythm in the aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, now I'm gonna listen to your abdomen or your bowel, or now I'm gonna look at your abdomen and listen to your bowel sounds. If you don't mind turning this way and laying on your back. Do you mind lifting your shirt a little bit for me? So, inspection, the abdomen is flat, and now I'm going to listen to all 4 quadrants in the abdomen for bowel sounds, starting in the right quadrant. All bowel sounds in all 4 quadrants are normal active. Now I'm going to palpate. Let me know if there's any discomfort when I do this. Starting in the right quadrant first. There was no tenderness or any masses or lumps noted in all 4 quadrants of the abdomen. Okay, now I'm going to have you sit back up and we're going to listen to your lung sounds. And you can just breathe normally for me. Okay, there were no extravenous lung sounds noted anteriorly in the front. Now I'm going to have you turn around so I can listen to your lungs on your back. Okay, there were no adventitious lung sounds posteriorly on the back, and I'm going to look at the skin on your back and make sure there is no breakdown. Skin on her back looks good, skin on her abdomen looks good, there was also no breakdown, no discoloration. Now I am going to check any lines, drains, or tubes that she would have, which she does not. Okay, that concludes our head to toe assessment. Oh wait, no it does not. Do you know where you are?
I'm in my room.
In your room? Okay, do you know what the date is?
December 5th.
December 5th. Do you know what time it is?
10:20.
10:20. And do you know why we are here?
It's for a checkup.
For a checkup in my head to toe assessments. So patient is alert and oriented all times 4 to person, place, time, and situation. Now our assessment is finished. I'm going to lower the bed because I raised the bed when I came in to working height. I'm going to lower the bed, raise both side arm rails, and give you your call light.
Thank
If she had grippy socks, I would put grippy socks on hers to decrease fall risk. Thank you for your time.
Of course.
If you need anything, just hit the call light and we will be with you. I'm gonna wash my hands on exit.